Okay? You don't write a care plan for discharge. You have to help the person adapt to the new health. About the academic staff, what's the difference? In the traditional view, emphasis on teaching. In the expanded view, emphasis on learning. The academic staff was place-bound. It means you have to go to a classroom for this hour to this hour and follow a course. Now we have virtual university. You don't have to attend classes at all, okay, if you have access to other means. A scholarship narrowly defined, congruent with personal interests. And you are going to study this because this is what you want to study only. Now it's broadly defined and it's congruent with the institutional mission. Every institution has their own mission. The service is perceived as quasi-charity before, and you were doing this for the sake of the people. Now it's valued for revenue generation. You need money to be able to continue to progress. We had a centralized administration. Now it's responsibility-centered management. Okay? Are Egyptian graduates being able to fit this environment? Okay, we can think a lot about this. What do we really need? We need to have a curriculum that is with real work applicability and teach nurses what they need to know to be competent and to make a difference. Okay, thank you.
Thank you, Dr. Shahrazad. We have got very nice applications, but we hope that our graduate, after taking their PhD in nursing, to be involved with all process of training in the clinical area. Because thank you very much, Dr. Shahrazad.
Dr. Atif Badran, Professor of Oncology, National Cancer Institute.
Assalamu alaikum. First, I like to thank Dr. Warda and Dr. Zainab and the chairman and the مستشفى 57 for hosting this conference. I'm talking, this is a very bad time for talking just before lunch break, but I'll try to make it faster. Our overall message is the clinical research which allow the advancing of science in the benefit of the community should always be conducted in accordance with ethical principles, respecting the patient's right, desire, and expectation. First, أنا عايز أسأل سؤال معلش، مين اشتغل ريسيرش في الموجودين معانا في القاعة؟ I mean research, yeah, as a member of the team or a research by himself as a PI. PI first. I want to know who's PI doing a research from the start, writing the protocol and doing everything. Okay. Okay. Ethics is the branch of a philosophy which deals with the dynamic of decision making concerning what's right and what's wrong. Usually the research there's field either towards the community or the nursing profession or a science. The National Institute of Nursing Research published a 10 landmark nursing research studies under the title of the Changing Practice Changing Lives. لو تحب اتكلم بالعربي انا ممكن اتكلم بالعربي. والانجليش English. Okay. First was the inadequate nurse staffing increased the risk for patient. Development on an index to reduce the pressure sore risk. Coping skill training improves teen self-management of diabetes. Helping youths to establish a healthy habit of exercise and diets. Healthcare team helps to reduce high blood pressure, reducing HIV risk among young minority women, gender-based differences in pain response. A community-based program improves the self-management of arthritis among older population, and transitional care improves the outcome for elders after leaving the hospital. Home nursing visits benefit low-income mothers and their children. History of ethics. Hippocrates on the 4th century make this statement: I will prescribe a regimen for the good of my patient according to my ability and my judgment, and never do harm to anyone. On 1947, Nuremberg Code issued after the Nazi experiment on the prisoners. On 1948, the Declaration of Geneva, which is directed to the physician. On 1964, Declaration of Helsinki, which is the core of all the ethical committee and everything about ethics in research. This declaration is revised many times on 1975, 1989, 1996, 2000, and 2008. This is a guideline for research on any human subject. As regard nurses, the first was in 1983, which is the Nightingale Pledge. I will point only on this, and they shall not take or knowingly administer any harm drug. The second here is I shall be loyal to my work and devoted towards the welfare of this community, committed to my care. I mean this, there is another. Here, I shall do all in my power to maintain and elevate the standard of my profession, and will hold confidentially the personal matter committed to my keeping, and all family affairs coming to my knowledge in the practice of my calling. In 1977, the Royal College of Nursing issues the Research Ethics Guidelines for Nurses. And on 1985, the American Nurses Association issued the Code of Ethics for Nurses. As I said before, the principle, the Declaration of Helsinki is the principle of the ethics in the research. So I point for some point, this principle, the Declaration of Helsinki is about 4 pages. I choose some points of these pages. First, respect for the individual right to make informed decision. The investigator duty is only to the patient or volunteer. The welfare of the study subject always takes the priority over the interest of science and society. Individuals and groups with increased vulnerability require special vigilance. Consent by surrogates, such as a parent or spouse, is allowed if the surrogate is acting in the subject's best interest. The research must be based on a thorough knowledge of a scientific background, a careful assessment of risk and benefits, a reasonable likelihood benefit to the population under the study. The research should be conducted by appropriate trained investigators using an approved protocol by an independent ethical review. If new information changes the potential risk, then the study may need to be stopped. The public should have access to information on the trial, and the result of the trial should be published. After the trial is complete, the interests of the subject are still part of the ethics of the trial. I'll explain the last statement here. After the trial complete, sometimes we do trial on a drug, and the trial duration is 2 years. And after these 2 years, there is some patient who already get benefit of the drug. We cannot ethically stop giving the drug after the 2 years. The responding patient should receive the drug till progression of the disease. Other ethical guidelines is the Council of International Organization of the Medical Science, our International Conference on Harmonization for Good Clinical Practice, which is known as GCP, and the national regulation of each country. Now I'm going to talk about the ICH, which is the International Conference on Harmonization. This is a technical requirement for registration of pharmaceutical product drug. ICH GCP developed to provide a unified standard for European Union, Japan, and United States. A tripartite agreement between them was signed on the 1st of May 1996. The Good Clinical Practice. This is a book of good clinical practice. Every investigator should have this with him if he are doing a clinical trial or a research. Good clinical practice, or GCP, is an international ethical and scientific quality standard for designing, conducting, monitoring, analyzing, and reporting trials that involves the participation of a human subject. Compliance with the standard provided public assurance that the rights, safety, confidentiality, and well-being of the trial subject are protected, consistent with the principle that have their origin in the Declaration of Helsinki, and that the clinical trial data are credible. The research is mainly by the investigator. The investigator gets the connection with the ethical committees, and the only one to contact is the investigator, and also connected with the sponsor. The sponsor may be pharmaceutical company, or there is the institute or the university where the research is done. GCP content, as I told you, it's about 8 chapters. The first is glossary, principle of ICH GCP, institutional review board or independent ethical committee, investigator, sponsor, clinical trial protocol and protocol amendments, investigator brochure, and essential documents. I will talk about some points of this GCP because it's too big. It's usually done the training in 2 days training. GCP trial principle: trial should conducted in accordance with the ethical principles that have their origins in the Declaration of Helsinki. Trial initiated and continued only if anticipated benefit for the individual subject and society outweigh the risks. The right, safety, and well-being of the trial subject are the most important consideration and should prevail over interest of science and society. The available data, non-clinical or clinical, on investigational product should be adequate to support a proposed clinical trial. The protocol must have received approval by an independent ethical committee. Each trial subject must freely give informed consent before trial participation. Medical care and medical decision in a clinical research always the responsibility of a qualified physician. Confidentiality of the record should be protected, respecting patient or subject privacy. As regards the institutional review board or independent ethical committee, the purpose of the IRP is to protect the right, the dignity, the welfare, and privacy of human research subject at institute by adhering to the ethical principle according to each institute, either to Belmont Report, Science Declaration of Helsinki, and the regulation of the institute and Supreme Council or Ministry of Health. IRP is the abbreviation of an institutional review board. IRP ensure that the rights of every human being to voluntary informed consent to research is respected. Responsibility of the IRP is to review the document, protocol, investigator brochure, informed consent form, the PI curriculum vitae, to conduct pre-initiation approval and for any amendment and yearly revision. May request more information before approval or may disapprove or discontinue an already running trial. And regularly receive reports of deviation, protocol deviation, amendment, protocol amendment, adverse event, serious adverse event, SUSAR, suspected, unexpected, serious adverse reactions. I will pass this, it's not important for you. The investigator section here include investigator qualification to do a trial or a research. It should also have an adequate resources in his hospital or his institute, medical care to the trial subject, communication with the IRB, compliance with the protocol, compliance with the or knowledge of the investigational product, randomization process and unblinding, informed consent of the trial subject, records and report, progress report, safety reporting, premature termination or suspension, and he is also doing the final report. This is the main part of the ethics, which is the informed consent. The goal of the informed consent process is to provide the individual with sufficient information so that they can make informed choices about whether to participate or not in the clinical research. The process includes the ongoing dialogue between the patient and the PI, principal investigator, or designated research team member. Informed consent, neither the investigator nor the trial staff should coerce or unduly influence a subject to participate in a trial. The language used in oral or a written information in the informed consent form should be as non-technical and understandable to the subject, his representative or witness. Prior to subject participation in the trial, the informed consent should be signed and dated by the subject or the subject legally representative. Ethical conduct of nursing research respect the person, beneficence, with the maximum good for the patient or for the study subject and the minimal harm for him. Justice means fair distribution for the community. Respect the community, especially in behavioral studies, and contextual caring the research behavior towards his subject. He's not a guinea pig to do any research on a person. He has his dignity. Elements of informed consent. The informed consent consists of 20 elements. First, all these 20 elements should be written in the informed consent. First statement, the trial is a research. We have to write this so the patient or the subject knows this is a research. It's not a treatment or anything else. The purpose of the trial treatment and responsibility and the possibility of randomization, the trial procedures, the subject's responsibility. Aspect of the trial is experimental, reasonable foreseeable risks, reasonable expected benefits, alternative treatment, compensation and or treatment available in case of the trial-related injury, anticipated payment, anticipated expenses. Subject's participation is completely voluntary and may refuse without any penalty or loss of benefit. Monitor, auditor, IRB or Independent Ethical Committee, IEC, and regulatory authorities will grant it to direct access to his medical record without violating confidentiality of the subject. Record identifying subject will be kept confidential. Subject will be provided with any new information. Person to contact for further information and in case of emergency. Foreseeable circumstances and or reasons under which the subject participation in the trial may be terminated. Expected duration of the subject participation in the trial. Approximate number of subjects involved in the trial. Ethical consequences for not obtaining an informed consent. Your subject didn't understand what was involved in participation. Your subject didn't understand they got a placebo rather than a drug. Your subject didn't understand possible side effect, rash, or even death. Thank you.
Thank you, Dr. Atif. Now we will open the floor for discussion, please. Yeah, because after that we'll have the lunch break. Any question?
الكمبيوتر ده مش بتاعكم. عرفت انا لما اسيبه هنا مش هتبقى بتاعي كنتوا. انا هديها لكم في الكليه انا ما
Yes, please, Dr. Anahit. Yes, Dr. Professor. Actually, I have two questions. Number one, about the public opinion for nurses. And you have mentioned that in the United States they have the highest respect level for the nurses. Do you think that, because they have a nurse practitioner, because she has a right to open a clinic, and the public that are treating the nurses the same like the view of physicians?
I totally agree because, well, one thing is that the American public is more satisfied by the nurse practitioners than the doctors. So that definitely has something to say about the image of nurses. And when you look at the research, American patients are more exposed to the nurses than the doctors. And because American nurses have a lot of clinical experience, I think that contributes a great deal in, right. And I have to say, Robert Wood Johnson Foundation has been running ads for the last 15 years to improve the image of nursing. That's why it's important to be politically active and get some agencies who would support the image by running ads in the newspapers and on TV all the time. It is amazing what they can do with those images.
Sorry, because I have another question. Sorry for, you you have mentioned about globalizations, because globalizations for, that nurses, all over the world, they are going to speak with the same tongue, with the same way, same procedure, same skills. So by this way, it's helping us, especially if it's a nurse, nursing informatics or evidence-based practice, What's about your opinion about it? Yes, please.
I think we have no choice, especially with the incredible advances in technology, that every one of us knows anything that's happening in the other world, in the other part of the world, within seconds.